Hello everyone, so I'm Jeannie and I'm just going to demonstrate quickly on what is stack shocks. I know most of you have seen the videos, or all of you should have seen the videos already on stack shocks. The one thing to remember and the rationale behind why we do stack shocks is that all of our patients now are in-house. We are no longer following the American Heart Association, which is taking into consideration people who have gone down out on the field. So since most of our patients, or all of our patients, are in-house, we know that each person has an electrical potential that's still within inside of them. So my electrical potential may be a little bit different than Marty's electrical potential, but nobody knows what that electrical potential is. If we act upon that electrical potential in a rapid manner, we should be able to convert that patient without even really having to start CPR in that patient. Again, the joules that you will use to convert the patient may vary differently between each person. So I may convert at a 225, where Marty may not convert until he's 325. So the rationale is to quickly charge your defibrillator, shock the patient, charge it again, shock it at a little higher joules, and then shock again at even higher joules. So 200, 300, 360 would be appropriate for an average sized person. But if you look at somebody who might be grossly obese and you're thinking about the depth between the surface of them and getting to the heart, you may not even want to start at the 200 range. You may start right at 300 or even at 360 and just hit them repeatedly at the same joules. So we're going to quickly go over how to treat a patient who is in atrial fibrillation and how to synchronize cardiovert the patient. So this gentleman, he's 62 years old. He's going to have a synchronized cardioversion. So of course, the thing you'd start with first would be to give him sedation, as we do up in the cath lab. We sedate the patient. Marty's going to ventilate.
Ventilation here.
Next thing you do is come up to your defibrillator. You hit the sync button. That will cause a little arrow to begin at the top of there. You begin it with, whenever you synchronize cardiovert, you're going to charge to 200 joules. So that is charging. Once you get to the top of the joules, hit clear, patient clears, and then hit the shock button.